Well, welcome everyone to Real Balance Global Wellness Services free monthly webinars. I'm your host, Dr. Mike Orlowski, and want to let you know that Real Balance Global Wellness Services is one of the premier leaders in wellness coach training, fully approved by the ICHWC and by the International Coach Federation, not just for continuing ed, but for approved coach-specific training hours. These webinars are offered once a month, totally for free, and they're archived at realbalance.com. You can check them out there in the resources section under Wellness Resources. And if you're a Real Balance student or alumni or faculty member, they're also archived in the Coach Center for perpetuity, you might say. Okay, so the way this works is you've been muted upon entry, and there's a Q&A function you've got available there on your Zoom screen. And we're going to be saving time at the end, about 15 minutes or so, for Q&A, for questions and comments that you've got. So be ready with your questions. So we have a very important topic and a very special guest for this webinar. It's really an important topic because everyone that's out there in the health and wellness coaching field has to justify their program or justify to their clients that, yes, coaching really does work. And to do that, we've got Dr. Ruth Wolever, who I'm very proud to say I have been a colleague of on the International Consortium for Health and Wellness Coaching for many years, as it turns out now. Ruth, how are you doing there? Looks like you've got, yeah, there we go. Okay, well, I'm going to turn this over to Ruth, and she can introduce the topic and her own slide deck on it. She's got some really important information to share with us. So I'd say go ahead and take it away, Ruth.
All right. Thanks so much, Michael. So an honor to be invited by you. We all consider Michael to be the father or grandfather, depending on his preference of the field. So it's really nice to have gotten to work together on the board of directors for the International Consortium for Health and Wellness Coaching for so many years.
Indeed.
Yeah. All right, so next slide. I just have to briefly make disclosures as part of my academic requirements, just to tell people where my funding comes from.
Yeah.
Next slide. Oh, and I should say that actually that's not all funding. The right side, all that work that Michael and I have been doing, that part's not funded.
Yeah, and Ruth has actually taken on a bigger task now of being president of that board and working with the organization to keep it moving forward. As it's been so successful, we've had over 1,000 coaches pass the first national exam for coaches this last fall, and that's always worth a cheer.
Yes, thank you.
So right. What are we looking at here?
Yeah, so as everybody on the call is well aware, the U.S. landscape right now is driven by really elevated healthcare costs that are estimated by the end of the year to have doubled in the past decade, approaching $4.4 trillion, which I can't even really conceptualize. And for employers who are having to pay a significant portion of the health insurance premiums, they've been rising at 4 times that of inflation. There are various estimates, but there's good consensus that chronic disease accounts for somewhere between 70 and 80% of the cost of healthcare these days. And 3/4 of those costs are confined to 4 chronic conditions that are largely preventable, that are made or exacerbated by behaviors. And those are cardiovascular disease, diabetes, obesity, and some of the cancers. Next slide. So as we know, it's extremely difficult to change behavior in a way that people sustain for the long haul. And most healthcare professionals do not have the time, nor really the expertise to help people engage in a behavior change process, cultivate motivation for that, and support it for the long haul. But that's exactly what the people on this call are trained to do. That is what health coaches specifically are trained to do. And as the effectiveness studies have been coming in over the last 15 years or so, there's really strong promise for coaching, changing a number of health behaviors, a number of variables that have to do with quality of life, some biological measures, and possibly healthcare costs. There's some exciting data on it, and the data is still very young. So we'll touch on that as we go forward.
Mm-hmm.
So the bottom line, which of course is what the CFO cares about, pun intended, is really that, when employees are activated and informed, they're most able to help craft lifestyles for themselves to prevent chronic disease and also to manage whatever chronic disease might be available or forthcoming. And independent of the chronic condition, the behaviors that we're helping people focus on are the same. Their healthy diet, exercise, stress reduction, adequate sleep, and adhering to medication or other medical regimens that might be important. Next
And it
slide.
seems like the key thing here is that word activated employees. And I'm sure you're going to be getting to what that's all about.
Yeah, well, I can just comment on it briefly. Activated employees are people that have not only the knowledge, but also the skill and the confidence to use that skill to enact whatever health behaviors are most important for them. So there is it's called the patient activation model, but basically that looks at the degree to which people are best able to manage their health, basically across 4 different stages. And for employers, of course, they want especially if they're self-insured, they want their employees to be in the same, in that same boat.
Mm-hmm. Definitely.
So the science, of course, has been growing a lot on how to help people engage, change, and maintain that change in their own health. And that's really what we're here to talk about today. Next slide. And you guys are the ones that know how to do it. So the question here is basically how to help people that are in a decision-making role invite you in or open the door for you to be able to do this work that's so powerful. Next slide. So this is kind of the overview of the steps as I see them, and we will open this conversation. I'll go through some basic points, and then we'll open this conversation to see. I'm sure that you guys have some great ideas to add, and I know, Michael, you probably will too as we go along. One of the most important things is really preparing for the conversation with whatever decision maker you've been able to get an audience with. And in that preparation, it means really bringing together kind of 2 different piles of research, if you will. One is about the problem that you can help them resolve and trying to quantify that problem. And we'll talk a little bit more about that. And then in addition to showing them the research about the problem that they need resolved, the research that shows why health coaching and how health coaching can help to resolve that very problem. So we'll kind of go through this step by step, and I'll direct you towards some resources, and then we'll open it up for questions and brainstorming.
Yeah, I think this is really going to be helpful for people because this is one of the things that our students, and we've trained thousands of them, keep coming back and saying, how do I really make this argument? Not only, what research data do I get my hands on, but how do I do it? So I really like how you're not just saying, let's go over all the research. You're actually sharing with people a process. Exactly.
All right, so the first thing to figure out is to try to understand what it is that the decision maker is really looking for. So it may be whoever it is you're having the audience with. It may be the business owner or the chief financial officer. In this particular case, it may well be an HR director or someone who oversees benefits.
Mm-hmm.
Of course, they are generally interested in cost savings. That's a really important driver for them. But they also may be very interested in employee health and employee satisfaction or morale. So at different companies at different times, I've been asked to take different roles depending on what the challenge or issue at hand is. So sometimes they're really wanting to change a health outcome, but other times they're really wanting the employees to feel cared about and supported and helped in their health. So the first kind of detective work you really have to do is understand what it is that in this case, CFO is looking for.
Mm-hmm. Yeah, I think what I hear new coaches that are trying to make this argument do that doesn't work real well is they just come in and do a sales pitch on coaching instead of inquiring about that company's needs and what are they already doing or not doing to meet those needs.
I think that is exactly right, Michael. And part of if we go to the next slide, part of that is really a discussion, as you said, inquiring what it is that they're already doing, which gives them, these are basic coaching skills, right? What are you already doing that's working? And what do you want? What are you looking for? So sometimes companies are big enough that stuff has been published on them, and you can find some things on the web. But for the most part, a lot of this data is very proprietary, and they really are very careful to keep it under wraps. So mostly you're going to find out about it through discussion and the inquiry that you just brought up. And you can certainly ask for the whole company, what are the major health concerns? But some of the larger companies, particularly those that have actuarials helping with their own kind of self-insurance processes, they know exactly what's driving their costs. So they've typically done a great deal of analysis themselves and have figured out that for them, the people that are on a trajectory toward diabetes are their biggest concerns. And the insurance companies, for example, have figured out very complex algorithms so that they know, for example, who's most likely to convert into diabetes in the next 3 years because they become considerably more expensive for them to take care of. So to the degree that you can get specific, that is ideal. Now, the cost drivers are going to depend on the demographics of the employee base and the size of the company. So if you can't get exact information about that company's cost drivers, then it is really helpful to learn as much as you can about the population of their employees. There are some individual differences depending on demographics and company size, but for the most part, the kinds of things that are being cited over and over again on the outcome side are pharmacy claims, so how much money they're paying in order to help people get the medications that they need. People with diabetes tend to be more expensive in terms of healthcare costs. People with obesity, same thing. People with metabolic syndrome that are on a trajectory toward either heart disease or diabetes or both. And chronic pain is the other condition, which is extremely expensive for companies. Next slide. So if you back up from the outcomes and sort of think a little bit about what some of the drivers are for this, so you're really getting more behavioral, if you will. Stress is a huge one. So this was a National Business Group on Health survey that was done in partnership with Towers Watson. And basically the companies that they surveyed, 78% of them said that stress was a major risk toward greater healthcare costs in their workforce. If you're not familiar with the National Business Group on Health, I suggest you Google it. They have an incredible, rich source of information. That's their purpose, right? Is to help companies. I believe they do a lot with the Fortune 100 companies, but they have their resources are available on a much broader scale. So the National Business Group on Health is a really helpful resource for people. Three-fourths of the companies were concerned about obesity and noted a trajectory where they ended up spending a lot more money on given employees that were suffering from obesity. The third risk was physical inactivity, also close to 3/4 of them. So that's a big place. The fourth is poor nutrition. So people eating, too much and processed foods and not getting the kind of nutrients we want. And the last, tobacco use. So this is the terrain, this is our terrain. This is the terrain of health coaches, right? Helping people better manage their stress and lose and manage weight and make better food choices and get physically active and stop smoking or using tobacco.
I think what really attracted me to this whole field years and years ago in the wellness field, as a psychologist like you are, Ruth, it all, keeps pointing back to the behavior that people engage in, the choices that they make. And, medical conditions, of course, pre-existing conditions, predispositions are factors, but such huge impact is made by the behavioral side. And we take a look at this array right here, and it reinforces it.
That's exactly right. And even, thinking about the medical conditions themselves, we know that stress can set people up for heart disease as well as make it worse. We take each of those factors. And one of the things that's both sad and exciting is that we're at a place in science now where it's really clear that these behavior choices are driving some of the conditions. And so the part about that that's exciting is that now it's getting attention because it's costing money to the companies and to society as a whole.
Exactly. Yeah, look at these costs. This is amazing.
Yeah, so chronic disease in the U.S. is $1.3 trillion in lost productivity, so from people having to take time off, and then another $2.8 trillion in treatment. If you look at the cost of stress, that's been estimated by the American Psychological Association at $300 billion a year. Incredible, just huge.
And the topic of stress, it's what people point to, but then they don't know what to do about it. I think companies especially don't know what to do about it, and they're often one of the primary drivers of the stress their employees feel.
Absolutely. And I think so many coaches are really, really skillful at helping people manage stress, right? Because the support of making choices that better align with what you care about is incredibly helpful, not to mention the social support of the process.
Yeah, or teaching people relaxation methods and then having a coaching process to keep them on track with actually practicing them. Things like that.
Exactly. So there's also a great deal of data around the different costs of treating obesity directly, but also comorbid conditions that come along with obesity. So those estimates are like $147 billion as an annual cost. And the impact on productivity, there are a series, this is the CDC statistics, but they range from $3.4 to $6.4 billion.
Astonishing.
Yeah, and in terms of tobacco use, an estimate of $183 billion a year in the combined loss of productivity and medical treatment costs. So we're talking about some really big numbers here.
And, it's worth mentioning, too, we're looking at U.S. statistics here, but worldwide, this is all a gigantic problem. over 50% of the doctors in China still smoke.
Wow.
Yeah, isn't that amazing? And over 50% of the men do.
Wow.
Only about 10% of the women. Now, does that say something about society or innate intelligence? I'm not sure. But, also the diabetes rate in China is equal to ours. It's all mind-boggling how much these behaviors and these same issues are being felt as the whole world changes.
Yes, absolutely. Well, as we spread our lifestyle, we're spreading our illnesses, right?
Yeah.
These are some stats on the cost of chronic pain to society. This is the first and largest study that's been done on this, and it estimated an annual cost, again, this is just US, right? Not to mention the world, of $635 billion a year. The incremental healthcare costs, meaning if you take out the healthcare costs that would be there for whatever the conditions were without the chronic pain component, and then you add in, you see what the increment is, we're talking about, $261 to $300 billion. When you estimate the productivity that's lost as a function of people dealing with chronic pain, also just an astounding figure. And the interesting thing about the chronic pain work is there are a number of estimates that would suggest it's even more than the cost for cancer, heart disease, and diabetes.
Wow.
Yeah. So this was from a huge study of 20,000 individuals who were representative from a sociodemographic perspective of a large portion of U.S. citizens.
Wow.
And so if you break it down according to kind of level or type of pain, on average, 10% of U.S. citizens are in moderate pain, these people above 18, and have a $4,500 higher annual medical cost than those people with no pain. 11% in severe pain have a $7,700 annual healthcare cost. If you look at it by type of pain, about a third of adults have some kind of joint pain, which translates to over $4,000 in higher healthcare costs. 25% arthritis, 12% with a functional disability. So these numbers really, really add up.
Yeah, they really do. And, something that people forget and that coaches need to remember is how interconnected this is with lifestyle and with your overall health. For instance, if you are quite a bit overweight, the effect on the joints is massive, and the pain levels can be so much higher. The effect on arthritis is going to be higher. It's all quite interrelated, and it can be the whole idea of lifestyle medicine is the idea that we can affect the course of an illness, maybe not cure it or whatever, but affect the course of it by improving the lifestyle.
Absolutely.
So there is something we can do about it.
Yeah. So when you're selling to the decision maker, I've shown you here some stats and pointed to a couple of resources about the actual problems that companies face. And again, the degree to which you're able to understand and to get from them their knowledge and data, if possible, of what it is that's driving the company's concerns, what's driving their costs, particularly from both a healthcare perspective and also a productivity perspective. And then you want to be able to explain why coaching is different than other approaches. So this is just a model I tend to refer to a lot because it's kind of a snapshot. A lot of people think that they know what coaching is and assume that it means, let me tell you what to do. So helping people to understand the difference in advising and recommending versus what you all are trained to do in terms of coaching. So I explained to people the difference in the model. The model that like typical biomedicine comes from is this medical model is a paradigm where there's a problem, where you identify a disease. So the paradigm is one of pathology, something's wrong. Mm-hmm. And the impetus is to try to fix the problem, which is really more motivated by fear. I don't want this problem, or I don't want to develop a worse problem. Mm-hmm. And the professional is really an expert in the kind of root cause of the problem and very focused on identifying how this came to be and what to do to eliminate it. But we as coaches are really coming from a very different model. And this is what the newest science and how people change and grow and sustain that change is showing, that we, when we're coming from a developmental model or a learning model, we're really focusing on what somebody wants. What is it they want to achieve? Mm-hmm. And by focusing on what somebody wants to be able to do, to optimally perform or to optimally grow or to optimally find a sense of happiness, the coach really comes across as a partner. So you're really partnered as opposed to taking an expert stance. The coach's expertise is really in supporting behavior change. But of course, the client is the person who knows best and is able to figure out best what's going to work in the long run in their life. So you will know the paradigm firsthand, but I think it helps other people understand the paradigm by comparing it to something that they're much more familiar with, like a regular, like the medical model or counseling model. And so helping people to understand that you're actually helping to support people to move toward what they want kind of has an innate, like, people get it. People understand that it's different, but they may not actually internalize it until they've been part of the process. Mm-hmm. So next slide. Oh, go ahead, Michael.
Ruth, as you've trained so many people at Duke University and at Vanderbilt University, you've probably come across the same thing I have, where a big challenge is to get our coaching students to make this shift in the way that they work with people, because they usually do come from a what's wrong and how can we fix it problem-solving approach.
Exactly.
And boy, the mindset shift is such a challenge for people to get over to this health coaching, wellness coaching approach that is so different. Describe the outcome you want. Get really clear about that. And then this process just helps people fill in the how to do it. It's pretty amazing.
It is amazing. I think, too, that a lot of times people understand its effectiveness more in the role of client when somebody's telling you what to do and you're thinking, don't tell me what to do.
Yep, exactly. Most people are like that.
Yeah. So I recommend actually offering a sample session or two. Could be to the CFO or to whoever the decision maker is, to let the person have a personal experience that's going to help them understand what's different. Mm-hmm. That's, of course, a business decision everybody has to make. How much are you going to provide sample sessions? But in a situation where the door is open and you may be able to actually get more business by really helping a decision maker understand, it can be a very useful move to give the person a few sessions so that they can understand firsthand what's happening.
Yeah, and one of the distinctions that this may really help with is you may have a executive there who's been through some type of business leadership executive coaching, and their coach may have been really a great coach, or they may have been more of a consultant type coach. So their idea of what coaching is may be a little different still. So they may again think that the health or wellness coach is going to be in there with recommendations and advice and all over the place. So making that distinction may be helpful too.
Yeah, that's a great point, Michael, because I do think it's easy for people to assume, oh, this kind of coaching is going to be just like that kind of coaching. And yes, it often is not. Mm-hmm. All right, so after you've explained why coaching is different and hopefully shown them, given them a sample session, then one really important piece is to be able to show or demonstrate some research that sells, if you will, coaching. And so what I would like to do is show you where some of these resources are so that you're able to utilize them. So let me just give you an example. So Gary Sforzo and Miranda Kay and Irina Todorova, about 7 or 8 other people, last year published what they called a compendium of the health and wellness coaching literature. It was published in the American Journal of Lifestyle Medicine, and they published it in an open access forum, a real gift to the field. So it is basically all of the literature on health and wellness coaching to date as of a year ago.
Wow.
And they're actually doing an update now so that there will be another one. And I just want to show you the article, and then I want to show you how to use the resources within the article. The article itself, as Michael's finding the link for us.
Can you see what I'm showing?
Well, I'm seeing my whole slide deck right now.
Okay, let me bring up a share that will show it here. Here we go.
Oh, perfect. Great. Yeah, so this is the article, and you'll see there you can download the whole article if you want. You can look and if you look off to the right, you can stay online with the full text or supplemental materials or the figures, etc. So under Find Out More, there's a list of full text, supplemental material, figures and tables, article metrics, related articles. So these are just portions of the article. Because it's an open access article, anybody can go online and access it. So the article itself kind of summarizes the high level of what we know in what we know about coaching overall, but also what we know in different disease or medical conditions. And what they've done that's just so incredibly helpful is actually in the supplemental material. So Michael, you could either go to the next slide and click, or you could just click on the supplemental material on the right if you're out on the web there.
Let's see, supplemental material, where am I going to find that?
It's to the far right, going down a little bit.
Oh, here we go.
Yeah.
Mm-hmm. Yeah.
And then if you click on the Appendix A, I'll show that one first. So again, this is available to anybody. And Appendix A, what it does is organize all of the literature according to conditions.
Okay, tell you what, it's going to come up in a different form, I think, an Excel spreadsheet.
Yes.
So let me go ahead and bring that up.
Okay.
And then I'll share that.
Great.
Yeah, this is fabulous to have all this in one place. My goodness.
Yes, I mean, really, such a gift to the field.
You know, I feel just so justified. I'll tell you, because I remember early on when we were trying to get this whole field going, we had some very cocky consultants who loved to say there is no, peer-reviewed journal article that says that wellness coaching works. And they were very, pontificating about that. And now we've got all this. Oh my God, this is amazing.
Yes. So if you look to the far left, you'll see, for example, cancer in the very first column. It's like lines 24 to 32.
Blow it up a little here.
Okay, there you go.
Okay, so we're looking, I see, lines.
Yeah, if you go down a little, or you can go back up a little. Yeah,
here we go.
Yes. There you go. So they're organized. There's cancer and cardiovascular disease. And if you keep scrolling, you'll see how they've grouped the articles. So this one's cholesterol.
Mm.
And if you just keep going, and there's diabetes and arthritis and dot, dot, dot. So they've put together the articles about different conditions.
Wow. Lots of diabetes articles. That's great.
Yes,
Mm-hmm.
exactly. And
hypertension. Awesome.
right.
And heart disease, of course.
Right.
Yeah.
And so if you've talked to a CFO, and you learn that they're most concerned about their employees that have diabetes and their employees that smoke, for example, you can find the studies specifically relevant to that particular situation.
Mm.
And then what they've done, if we go across the column, so the first sort of chunk, so you have the reference, then you have the type of patient, and there's a little code up above that shows, C's for cancer, CH for cholesterol, CFS for chronic fatigue syndrome, etc. Under population, under type of patient. And then population 2 is whether they also included people with psychiatric disorders or not.
Mm.
And then there's some specific aspects of the health coaching. So in terms of defining it as health coaching, was the health coach trained in behavior change theory, motivational interviewing, or other communication techniques?
Mm.
And what they're trying to do here is get at the degree to which the article is talking about health coaching, but actually not referring to the same kinds of things we do that you guys are all trained to do.
Yeah.
So
this is so fantastic. I remember, well, of course, this has been a big part of the work of the consortium to try to get some consensus on, okay, what really is health and wellness coaching? I remember very early on in the field, there were a few studies, a couple that came out of Australia and a couple of places where nurses did health education, and they published them calling them, health and wellness coaching.
Exactly.
And they had mediocre results,
Well, and I think part of the reason the field has been so confounded is because, you find one study where they call you and remind you to take your medication and call it coaching.
Right.
But the patient hasn't learned any skill in that.
Yeah.
So, yeah.
Exactly. Disease management at its very basic, not that way, but they've learned they've had to do a lot more now.
Exactly.
Yeah, this is fabulous. Oh my, this is like, I feel like kid in a candy shop looking at it.
Woo!
Wow.
Right. So there's all the inclusion criteria, and then you get over to method, and they note if it's quantitative, so if there's like statistics around it, if it's qualitative, or if it's mixed, meaning both.
Mm-hmm. Yeah, there's a mix.
Mm-hmm. Yeah, they note whether an institutional review board is used. Sometimes they put additional comments.
Mm-hmm.
And then if you are able to go even further to the right, you can also see what type of study it is. Let's see, you might have to have the cursor there you go. So if, for example, it's a randomized trial, that's going to be the strongest research design. One more column to the left will show whether it's randomized or, there you go. NRB is a non-randomized but blinded. So there's a whole series of, in the legend, a whole series of acronyms and what they refer to. And in essence, basically, they also note how big the study was, how many people were in the study, and they note the length of the coaching, the number of sessions provided, and then the outcomes.
This is amazing. Wow. So I'm just kind of aware of the time. I want to make sure we cover a few more things and then leave time for people to, interact.
Sure.
We've got over 100 people registered for this call. and about, smaller number that attend, but many people will be watching it later on as a recording. And I'd like to include, some of their questions and comments, of course. But this is fabulous. Would you like me to go back to the slideshow, or there's a couple more important things here?
No, I think you've got the gist. We can go back to the slideshow.
Okay.
Yeah, it's just an amazing resource. I wanted to make sure people knew how to find it, how to get to it. And the links, of course, are on the slides, and we can make a PDF available of the slides, or you can just Google Sforzo 2017 Compendium. That's another way to find it.
Yeah, let's mention that at the end again, how people can get a hold of that PDF and so forth.
Okay. So these were the supplemental charts that we mentioned. So what I might do, just for example, let's say that type 2 diabetes was a big concern. Then I might pull out a study that had some methodology strengths to it. And so this was, for example, a randomized controlled trial, and it showed a number of things: improved patient activation, improved medication adherence, improved frequency of exercise, better social support, better what's called benefit finding, the ability to kind of see the silver lining in the cloud, as well as better glycemic control in people who were poorly dysregulated from a blood sugar perspective. So if I knew that the glycemic control is what was important, I might just present that finding. If I knew that medication adherence was a concern, I might present that finding. So part of the trick, I would say, is figuring out what it is the person really needs to know about in order to see that coaching impacts that particular outcome of interest. Next slide.
Yeah.
If I knew they were worried about metabolic syndrome progressing to heart disease, I might pull a trial that showed, for example, that, again, this was a randomized controlled trial, that health coaching led to lower prediction of developing heart disease 10 years out compared to a control group that got regular medical care. Next slide. And then this is one of the strongest cost effectiveness trials that has been done. This particular trial done by Wenberg was published in 2010, so it's a fairly old study, but it had 174,000 people in it. Health Dialogue was the company that had provided the coaching. And they looked at people with various chronic conditions and what they called preference sensitive, conditions. So that's something like, a bad hip, and the person has to make a decision if they want a joint replacement or they want a more conservative approach to managing it, or they want to wait on a joint replacement. But in essence, what they did was provide health coaching to half of the group in a randomized way, and they tracked the average cost per member per month, both for the medical and the pharmacy claims. And they found that after 1 year of this, there was a 3.6% lower cost in the health coaching group, which that's about $8 a month. Most of that came from saving money in hospital admissions, about a 10% reduction in hospital admissions. Because the cost of actually delivering the program was less than $2 per person per month. You can go to the next slide. That's what, that CFOs love, this return on investment idea, sort of how much do you spend and what do you get back? And so the stats in this are very conservative. But in essence, they're getting a benefit 4 times greater than what they spent.
Wow.
So we're early in the cost effectiveness studies. There are just a handful of them. And this is an area that the field, I hope, will really continue to grow in. But showing something with cost effectiveness generally does get people's attention.
Well, and it's great when we have, studies like that available, because one thing we know a lot of the disease management companies that have been doing coaching, they've been, very effective because they get their contracts renewed every year, but their data is very proprietary. They don't want the next company down the road, figuring out how to really do it as well as this company. So
exactly,
it's always been a frustration.
Yes. So last slide, if we go to the next one. So the other thing that is important to understand about the research is that the resource I showed you is really including things that are very similar to what we call coaching. But the bigger literature uses the term coaching to describe a lot of different things, as Michael was pointing out. And so when you're making the choice of what data to show, you want to make sure that the intervention that was studied matches what we would all consider, I put in quotes, real coaching, but coaching as we've been trained to do it. Yeah. And one way to do that is to suggest that that the individuals providing the intervention for whatever company you're selling to ensure that there's at least a minimal bar of competency. And one way to do that is to suggest that they use National Board Certified Health and Wellness Coaches, which is, part of the initiative that Michael and I and others have been working on for a long time now.
Yeah, so I want people to really get started with the Q&A here. We're going to go ahead and shift over here to that and take a look at some of your comments and questions and so forth. I think that'll be really, really helpful. So if folks could just take a moment to, gather their thoughts and pull that together, we can get a kind of a dialogue going here. I know, Ruth, it's like I said, really kind of validating, to see all of this being done. And to be able to point to it, I think that's always been the tricky part. It's like, well, where is this information? The consortium has tried to put together a resource, and there was the big study of literature that you did along with some colleagues several years ago, and that was our best guide up until this new one. And this one is, I love how obsessive compulsive it is in detail. It's amazing. Exactly. We've got so much ammunition here to use to make that argument that you're talking about here.
Yes. Very, very generous of the authors to share all of that.
Yeah. So one of the people here is asking about getting the slides. And let's just talk about how we can get that PDF available. What should they do? Email you or email Real Balance or what?
I think Real Balance is the best strategy, and I'd be happy to provide you with a PDF that you can put on your website or send out to people who request, whichever your preference.
Yeah, we'd love that. I think that would be very valuable to people. Okay. Yeah, cool. Okay, and what's the best way for a sole practitioner, Shannon wants to know, who wants to do corporate health coaching to break into this side of health coaching?
Yeah, so I think there's two different ways. One is to get hired by a company that's their niche. So there are a number of companies that already have corporate contracts that are always looking for good coaches. So that's the easiest one if you don't want to have to make the sales yourself, if you want to just do the coaching. The other is to network with connections of people that that are open to the concept that you could do this kind of a presentation with, and understand that it's going to be a series of discussions. It's the very rare, very, very rare situation where one conversation and they, give you a contract. It typically has to do with developing a relationship and continuing to show the benefits. One thing that can be helpful is to also offer to do a pilot at low cost to get the data across the pilot so that the company themselves can be seeing the benefit. There are a number of companies that will entertain a pilot long before they'll give a contract,
Right.
and that can be a good foot in the door.
Yeah, and don't forget to offer, as a pilot, group coaching also.
Yes.
Especially if they have a population that's particularly plagued by one style of, health problem or behavioral problem. That can really be helpful. The other, I would say, is to look at companies that they may not be turned on to health and wellness coaching yet, but they may already have a coaching program for leadership or something like that. And you can plug into that and just accept, the rates and the limitations of that program, but within it now be able to offer your health and wellness coaching. That's something that I did with Denver Water and the Denver Police Department early on in some of my work, and it worked out really well.
Oh, that's a great idea, Michael.
Yeah. So a couple more questions here. Do any health insurances cover health coaching sessions?
Yeah. Yes, interestingly, the big companies have their own health coaching programs. So the Aetna, Humana, the Blue Cross Blue Shield, Cigna, Optum, United/Optum. They all have their own health coaching programs because, as Michael mentioned, they know that it works. They see that it reduces. So what they do is have internal coaching programs that they use to try to control their costs. In terms of a fee for service, whether a given insurer will cover a coaching session, I'm going to answer that in two parts. So one part depends on if you have some other licensure as well as the coach training. So there are ways for nurses to bill, for mental health professionals to bill. Doing coaching and using a CPT code or a procedure code for billing that falls under one of those particular professions. There is this year, for the first time, I guess it actually started in 2017, there are 32 or 33 insurance companies, as well as the Center for Medicare and Medicaid Services, began to cover the cost of the diabetes prevention program, which is a lifestyle program delivered by coaches, which is really opening the door in a large way to other preventive kinds of services, like coaching eventually getting covered. And there is a CPT code just for coaching. However, the reimbursement is extremely low, and so it's it only makes sense if you to use it if you're using it all. If you're set up so that you're, for example, in a primary care practice using it constantly, and it's set in 15-minute increments. So. So they're moving toward it. Some are further along than others. And ultimately, it's really kind of the accountable care organizations that make the most sense for coaching to be in, because a lot of what we do improves the cost trajectory down the road because you're helping people be healthier and avoid things. So you need to have a situation where the cost benefit will be seen by the whoever's offering the service.
Mm-hmm. Okay. So we've got a question here from Bruno Bellino asking how you can present this area in a hospital, how you can kind of make the case in that setting.
Yes, absolutely. Well, I think you follow the same the same general principles, but instead of seeing what the CFO wants to know, you might think about whoever the person is that's going to allow you to speak, what they most care about. So, for example, if the oncology department is who's going to let you come in and talk, you may pull some studies on how coaching helps oncologist patients manage a number of things they have to deal with as a function of their treatment. If it's the endocrinology who lets you in, then you may want to pull some of the data around, working with folks with diabetes. So same concept, but you just want to present the data most relevant to whoever it is that invites you in.
Mm-hmm. Okay. Now, this is an interesting one here from Ashley Miller saying, with coaching and now with the ICHWC, we obviously changed it to international, establishing an international reach. What literature do you suggest reviewing for global, more progressive employers who are taking advantage of wellness initiatives?
Yeah, so, I would, even though this article was published in an American journal, it does cover a number, the search criteria was the worldwide literature. There's a lot of great studies coming out of Scandinavia, Australia, the UK. The UK has a huge initiative called Better Conversations, where they're training, the National Health Service is training the primary care providers in coaching to improve their communication skills and their behavior change outcomes. And they have actually done a large-scale systematic review of the literature in order to get the National Health Service financially behind this. So you could also look under their website, Better Conversations. But anyway, all of this literature is relevant globally. The other thing I would say that's a really important kind of sales point, if you're working with a company that has a global reach, is that, coaching often is done from afar. So you can be providing services all over the world, right, from your office in wherever you are, which is not the case of all of the wellness services that are provided. So that's a definite benefit.
Yeah, I mean, technology's made it a small world. I've coached people on about 4 different continents. And it's pretty amazing. Yeah. So here's another question here. I've been doing research and don't see that FSA. Now, what would FSA be? Can be used for health coaching.
I'm wondering if you're referring to like federal savings accounts, like health, healthcare coverage accounts.
Yeah, the question is, do you think this will change in the near future? What's the status on legislative initiatives?
Yeah, so I don't know the status on legislative initiatives, but I tell you one thing that has worked for some people is if the physician writes a letter of medical necessity for the coaching and explains why it's medically indicated. So it can't just be to optimize health, but it has to be like this person has such and such condition and regular exercise is medically indicated. They've been most successful with coaching. Sometimes it depends on who the FSA is run by, but sometimes that actually will be allowed.
Okay, fabulous. Well, what a great time together. I mean, you just provided us with the keys to the kingdom, you might say.
Let's take over the kingdom.
I mean, really, this is what a lot of people have been looking for. That one resource, of course, is fabulous. And people can get a hold of a PDF just by emailing us here at Real Balance. Check out our website and the training that we do. We're offering both fully interactive webinars and also live on location trainings. And next month, I'm going to be doing a webinar on the 25th of May, talking about more on self-mastery, being self-vigilant in the way that you do your coaching, something we often refer to in therapy and in coaching called getting yourself out of the way. So please check that out next month. And stay connected, realbalance.com. You can hit B for blog to get my blog up there, or you can go to that WordPress address there. But just give us a call or email us at wellness@realbalance.com for that PDF of Ruth's fantastic presentation, or just to talk with us about anything that you want to know about furthering your coaching career that we can be of help with. So again, Ruth, I really want to thank you tremendously for this. I think it's just what the I don't know if you want to say what the doctor ordered, but it's what the coach has ordered.
Thanks, Michael. It's a pleasure.
All right. Thank you very much. All right. Bye-bye, everybody. We'll see you next month.